Aging is often discussed as a universal biological process, yet mounting research reveals that it unfolds differently in men and women, right down to the cellular level. From hormone fluctuations and immune function to mitochondrial activity and gene expression, the aging trajectory is strongly influenced by sex-specific biology. These differences don't just shape how men and women experience aging, they also affect how they respond to anti-aging treatments. As science delves deeper into longevity strategies, the idea of one-size-fits-all is increasingly giving way to more nuanced, personalized approaches that recognize biological sex as a key variable in both the aging process and its potential reversal. One of the most prominent sex-based distinctions is in hormonal aging. Women experience a dramatic hormonal shift during menopause, typically around their early 50s, marked by a steep drop in estrogen and progesterone. These hormones do far more than regulate fertility. They also influence bone density, cardiovascular health, cognitive function, and skin integrity. This sharp transition often accelerates visible signs of aging, as well as the risk of age-related diseases such as osteoporosis and Alzheimer's. Men, by contrast, experience a more gradual decline in testosterone starting in their 30s or 40s. While subtler, this reduction is associated with decreased muscle mass, slower metabolism, and reduced libido, markers often tied to male aging. At the cellular level, sex differences are equally striking. Women generally have longer telomeres than men, which may partly explain their longer average lifespans. Their immune systems are typically more robust as well, especially in younger years, which offers better protection against infections and some cancers. However, this stronger immune response may come at a cost. Women are more prone to autoimmune conditions, which can contribute to chronic inflammation over time. Men, on the other hand, are more susceptible to cardiovascular disease and certain cancers earlier in life, often tied to differences in lipid metabolism, oxidative stress, and mitochondrial function. These biological divergences extend to how anti-aging treatments work. Take caloric restriction, one of the most studied longevity strategies. While it has extended lifespan in numerous animal models, its effects in humans appear to differ by sex. Some studies suggest that women may be more sensitive to caloric restriction, potentially risking hormonal imbalances and bone loss if not carefully managed. Men, meanwhile, may experience greater metabolic benefits, such as improved insulin sensitivity and fat loss. The implication is clear. Fasting or dietary restriction should be tailored not just to individual health, but also to biological sex. Even pharmaceutical interventions like metformin and rapamycin may operate differently in men and women. Metformin, widely used for diabetes and now under investigation for its anti-aging potential, appears to improve longevity more robustly in male animal models than females. Conversely, some studies show rapamycin extends lifespan more effectively in female mice than males. This suggests that underlying metabolic and hormonal differences may influence how these drugs interact with nutrient-sensing pathways like AMPK and mTOR. Understanding these sex-based mechanisms will be crucial to optimizing treatment regimens for each individual. Nutritional supplements, too, are not immune to these differences. For instance, NAD+ boosters like NMN or nicotinamide riboside may restore cellular energy more efficiently in men, who tend to have greater age-related mitochondrial decline. Women, whose hormonal fluctuations play a stronger role in regulating mitochondrial dynamics, might respond more variably depending on menopausal status. Antioxidants, phytoestrogens, and adaptogens may also offer different benefits across genders, especially when used to balance hormone-related aging processes. Psychological aging, often overlooked in longevity research, also manifests differently by gender. Women are statistically more likely to experience depression and anxiety, particularly during hormonal transitions such as postpartum or menopause. These conditions can accelerate aging through chronic stress, inflammation, and sleep disruption. Men, meanwhile, may experience emotional aging more subtly, often through loss of purpose, isolation, or reduced testosterone. Mental health interventions, stress reduction strategies, and even psychedelics may need to be adapted to target these gender-specific psychological burdens, which can have very real biological consequences over time. Importantly, recognizing gender differences doesn't mean reinforcing stereotypes. Rather, it means embracing a more sophisticated understanding of aging, one that accounts for the full spectrum of biological sex and hormonal diversity, including transgender individuals and those undergoing hormone therapy. As personalized medicine advances, sex-specific biomarkers and treatment protocols may become standard practice in longevity clinics. The future of anti-aging science lies in precision. And that means moving beyond one-size-fits-all protocols to embrace the complexity of sex-specific aging. Tailoring treatments based on gender will likely not only enhance effectiveness, but also reduce side effects, improve quality of life, and extend health span more equitably. In doing so, longevity research honors its ultimate goal, not just to extend life, but to make those years vibrant, strong, and uniquely adapted to the individual.